Next on our childbirth complications series, we're going to be discussing shoulder dystocia, what it is, how it's managed, and how to prevent it. If you're new here, my name is Jamie. I'm a midwife. I've been attending births for over a decade. Shoulder dystocia is a complication that can occur, but it is rare and your provider is trained to manage it. So what causes a shoulder dystocia? A shoulder dystocia occurs during birth when a baby's head is born, but the shoulders get hung up on the mom's pubic bones. So how that is managed is your provider may go in and internally release the shoulder from the pubic bone with a variety of maneuvers, or simply moving the mom to a different position may cause the shoulder to release and allow the baby to be born. Some of the positions that a provider may move a mom to is hands and knees. Even lifting a leg in a runner's lunge can help pop the shoulder off the pubic bone, or a position called McRoberts where they are flat on their back with their knees pulled up to their chest in combination with some of these hand maneuvers may be used to release a baby and allow them to be born. So how it can be prevented. Oftentimes shoulder dystocias cannot be prevented, but there are things that are more likely to lead to a baby with shoulder dystocia. One of those is gestational diabetes, and that is because it may cause the body of the baby to be bigger than the rest of the baby and more likely to get caught during childbirth. So managing gestational diabetes is the first step in preventing big babies. If you have a history of shoulder dystocia, you are more likely to have a reoccurring one, and it may be worth talking to a provider how to manage the next birth to prevent it out the gate. Third, a lack of mobility in labor is going to be more problematic when managing a shoulder dystocia because moving the mom often helps resolve the shoulder dystocia quickly. So either avoiding epidurals or having a little bit of mobility with an epidural so that in the event of a shoulder dystocia, you can move about more easily. How is shoulder dystocia preventable? If you have gestational diabetes or even a history of large babies, controlling your sugar during pregnancy and working on a healthy weight gain during pregnancy may be beneficial for you. Choosing more upright positions and positions with more mobility can help because it widens the pelvis and makes more room for the baby to come through. But here's the truth. Shoulder dystocia can happen even without any of these risk factors, so the focus should be on choosing a provider who is well equipped to manage shoulder dystocia, and you can ask them whether you're interviewing a provider or during your pregnancy how they manage shoulder dystocia, so you know what to expect should it arise. Shoulder dystocia is scary to think about, but with the right provider and the right maneuvers, it's usually managed quickly and mom and baby come out just fine. Our next video will be discussing neonatal resuscitation, and that'll wrap up our series about most common childbirth complications. So stay tuned.